A very good afternoon to all of you, and thank you for attending today's session. Today's talk is going to be on nutrition in sickle cell disease, an opportunity for policy and practice change. It's the first of the kind of a talk we've held in the northern side, and it's a very, very important topic that comes up in our clinical practice in community centres, and I don't always have all the answers, so I want to welcome and say thank you to Claudine Matthews, who is a registered dietitian with Health and Care Profession Council in the UK. She has over 13 years of clinical experience in the NHS. She previously worked as a dietetic practice educator and lecturer, and is currently employed as a primary care network dietitian. Claudine is a consultant nutrition in sickle cell disease. He has dedicated the last 8 years to pioneering the nutrition landscape in sickle cell disease. She's published a number of articles on the topic and is currently in her final year of professional doctorate degree, focusing on integrating nutrition into sickle cell healthcare profession. Claudine, thank you very much for today's session, and over to you now.
Thank you so much for that wonderful introduction and for the invitation. It's a privilege for me to be here and have the opportunity to share on a topic that I feel very passionate about. I want to start with the presentation by asking you a question, and I've done this when I did the talk to the Pan Midlands cohort as well. And I want to ask you the question, why do you think nutrition in sickle is important? You may not think it's important, or you may think it's important, and I'm hoping that through the presentation and what I will share through the presentation, that will inform your answer. I'm not going to test anybody at the end, but yeah, I just thought I'd get the cogs flowing, sort of, to get you thinking about nutrition in sickle cell disease for your own. So as I've already been mentioned, my title for today's presentation is Nutrition in Sickle Cell Disease, an opportunity for policy and practice change. And I've gone with policy and practice change for the simple reason that if we do not focus at this level, if we don't try to influence policy and practice, then change on the ground, change in clinical practice, change within community centres will never happen. And so I'm hoping that through sharing, but also through my doctoral work, when I'm able to publish and share, that it will be able to make a difference at this level. So my presentation will have 3 parts. I do like the number 3. And the first part will touch on the rationale for nutrition in sickle and just a little bit of an overview of the scientific evidence base in support of the need for nutrition in sickle. Part 2 will look at the nutritional implications in sickle cell, because I think that's a really important aspect for you to understand why nutrition in sickle is important. And then part 3 will touch on my research project, linking research to clinical practice, and then obviously to working towards policy and practice change. So I can't start this talk without first giving you an overview of why I'm drawn to sickle cell and nutrition. So I grew up in South Africa under the apartheid regime, and I experienced firsthand my own oppression and disempowerment. And this resulted in me having a worldview for social justice, advocacy, and empowerment. And so when I was introduced to sickle cell in 2011, it was really easy for me to make that shift to this medical condition. So 2011 is when I was introduced to sickle cell. I was asked to represent the dietitians in my trust at the newly formed Sickle Cell MDT. And at that point, I had never heard of sickle and I knew nothing about sickle cell. But in 2011, just a year on, I accepted a 12-month seconded role to work as a social liaison officer. So I left dietetics for that time frame to support sickle cell patients with their social care needs. So my understanding of nutrition in sickle and sickle as a whole is so much more than just the nutrition side. I've actually worked for 4 years supporting the patients with the social care needs, as I mentioned. But it's in 2014 that I stumbled across nutrition in sickle cell. I was actually reading an article about acute trauma as an emerging speciality in nutrition dietetics. And as I was reading, I was thinking about sickle cell, and I thought, but that's what happens in the blood vessels of sickle cell patients when they have a crisis. It's quite traumatic. And I thought that if nutrition can play such an important role in acute trauma, then why not sickle cell? So that started my interest and investigations looking at nutrition in sickle cell disease. 2015, I decided I wanted to develop a national nutrition strategy for sickle cell, and I was told very vehemently that if I want to do that, I would need to do a doctorate. So in 2016, enrolled onto a self-funded doctorate, which I am in the last few months of, which I'm grateful for. But as a consequence of that work, I was then invited to write the first ever national nutrition standards. That's part of the 2018 clinical standards, and I'll say a little bit more about that. But my compelling mission is towards supporting the integration of nutrition into sickle cell healthcare provision. And this is to improve patient outcomes, overcoming the main challenges which I've encountered, being poor nutrition knowledge and awareness, poor nutrition resources available to both sickle cell patients and providers, and ultimately poor nutrition service provision for patients. So coming on to part one. So what's the rationale for nutrition in sickle cell disease? So why nutrition in sickle matters? It matters because of patient safety. It matters because of patient experience, and it matters because we have to do all we can to improve the quality of life outcomes for the patients that we serve in our spheres of influence. And we get information from the NHS outcomes framework towards what we can do and what we need to focus on in terms of improving the quality of life outcomes for patients. And so domain 2 of the NHS outcomes framework points us specifically towards improving the quality of life outcomes for sickle cell patients. I just this week discovered that sickle cell at the moment is not actually classed as a long-term condition, and I'll leave that for you to ponder on. I was quite surprised, but there you go. And then domain 4 is all about improving patient experience, and I do believe this is so important because currently there is limited nutrition service available for sickle cell patients, and that will impact on the patient experience. So we've also got the public health outcomes framework, and this framework is focused on the life expectancy, improving the life expectancy of people with long-term conditions, specifically working towards improving and achieving a healthy life expectancy. And this is very relevant to our sickle cell population. But more than that, is also focusing on reducing health inequalities and improving the health status and health outcomes for patients with long-term conditions, and that includes sickle cell patients. So nutrition in sickle cell, you will find, and if you'll read in the national standards for sickle cell on page 71, that nutrition is only emerging as a public health problem in a sickle cell context. I say this because we actually have over 60 years worth of existing scientific evidence about the role of nutrition in sickle cell. So I can't quite understand that it's only emerging, but there you go. And therefore, in my opinion, nutrition in sickle cell is currently an unmet need for many sickle cell patients, a growing health inequality as a consequence, with negative impacts on the health outcomes of those patients affected by nutrition in sickle cell. So moving on to some of the existing evidence-based in nutrition in sickle cell. So some of you may have read some of these articles, some of you may not have. But one of the common ones that is available, articles available, is the Heyman et al. Study of 1985. And this is actually the first direct study to demonstrate improved nutritional outcomes for both macro and micronutrient supplementations in sickle cell patients. Although the study only had 5 patients as part of the study, it was one of the first ones to demonstrate the positive effect of nutrition, both the macro and the micronutrient supplementation. And that's something to bear in mind. Building on that, the 2010 review article, and again, some of you may have read this yourselves, Hyacinth, Guy and Hibbert, And what I wanted to highlight from this article, review article, is the fact that they identify undernutrition as a significant clinical feature and a serious complication in sickle cell. Now we know about the clinical features of sickle cell disease, and we know about the many complications we find in sickle, but we don't often hear of nutrition being identified or described in this way. So this is a really important point to highlight in this particular review paper. A further review paper in 2019 by Umiakun and Hibbert. And why I've chosen this one is because they actually call for nutrition to be considered an adjunct or an add-on management option in sickle cell disease. And what they're saying in this article is not an either-or scenario, so either nutrition or management. It says that the nutrition management of sickle cell patients should happen in addition to, adjunct to the medical management, so enhancing the working or the efficacy of the disease management treatment options for sickle cell patients. And then two further articles I highlight here, Mandis et al. 2016 and Kamal et al. 2021. And both these papers, they identify nutrition as an independent indicator or predictor of disease severity in sickle cell disease. And Kamal et al. 2021 goes on to say that the macro and micronutrient deficiency found in sickle cell needs prompt diagnosis and management as part of standard care. And this is really key for us to pay attention to, that, as you know, in the Heyman et al. Study identified, you know, the positive effect of both macro and micronutrient deficiency. And here this paper is saying that we need prompt diagnosis and management, but importantly as part of standard care available to sickle cell patients. This is an example of a qualitative paper that I found, and I'm sharing this, Evers and Landis et al. 2001, although 21 years ago. What's interesting about this paper is the authors, they recruited 37 sickle cell caregivers of children between the ages of 5 and 13 years old, and 35 out of the 37 caregivers actually reported experiencing problems with their children's nutrition. And 93 nutrition-related problems were identified, although they identified that these were mostly amongst the pediatric patients. But if you look at the pain-related problems, there were 56 pain-related problems identified, 57 negative feelings about sickle cell, 37 coping with pain, and then 29 problems identified with teachers, peers, and schools. And when you look at the conclusion bit of that article, although they note and highlight the nutrition-related problems, what they don't do is to offer any nutrition support in response to those 93 nutrition-related problems. But they go on to make clear recommendations of physicians referring patients to psychology and social work, saying that this is beneficial. And this again just highlights 21 years ago, and as we've seen in the Kamal 2021 paper, that the problem of nutrition in sickle cell is persistent and something has to change. So I mentioned in the beginning about the national nutrition standards, which I was asked to write. So despite the inclusion of the national nutrition standards as part of the clinical standards, you know, there's a 300-page document, the clinical standards for the management of adult sickle cell patients. No one knows about the standards. You know, just in the week I asked people, have you heard of it? And you know, last week at least, and people have said, no, we haven't heard of it. So these standards, if you've not already come across them or heard of them, they are found on page 75 to 77 in the national standards. And I will encourage you to go and have a read if you haven't already. There are 4 recommendations to go along with that as well. So with people not knowing about the standards, there's limited awareness of the standards, and limited awareness means that it's not currently being implemented, and it's certainly not being integrated into existing policy and practice change. So just very briefly what the standards are. Standard 1 calls for dietitians to be part of the sickle cell MDT. And again, I don't know what's happening in your trust or your services, so that's something to think about. Standard 2, sickle cell patients need to be screened for malnutrition. Again, I don't know if that's happening, by adequately trained personnel, dietitians or nurses with training, and then standard 3, sickle cell patients who have been screened and found at risk of malnutrition need to be treated by suitably trained healthcare professionals, including dietitians. So what happens when nutrition in sickle cell is overlooked? Patients are left to self-research and self-manage their complex nutrition needs. If you look at other similar genetic conditions, particularly an example being either COPD or, sorry, not COPD, CF, cystic fibrosis, you will find that nutrition in cystic fibrosis is a core management option within the care provision for those patients, but certainly not within sickle cell, which means patients will have to find out for themselves, what they need to know with how to manage their nutritional needs. There's poor referral rates of patients to the dietitian as a result. Limited dietetic involvement because there's no need created because the referrals aren't being made. There's a lack of nutritional assessment for patients with complex nutritional needs because, again, that is done by a dietitian, and if referrals aren't made, they won't know, and obviously the patient is left, to manage their own nutritional problems. Nutrition is overlooked as a management option and is not part of standard clinical care. And currently, a general approach is adopted to managing the complex nutritional needs in sickle. When you speak to people about nutrition in sickle, the predominant sort of feedback that I get is about healthy eating. And you will see through the presentation that nutrition in sickle cell is certainly more than just the food side of things. So that concludes part 1, and now we'll go on to part 2, the nutritional implications in sickle cell. So the context for nutritional management, I have to look at this and give you the context in the fact that looking at what we already know about sickle cell disease. So sickle cell disease has both medical and nutritional implications. But the medical management of sickle cell patients is really well developed and is based on the medical model of care. However, what we find is the nutritional management of sickle cell, as I've mentioned, and I will continue to mention, is currently overlooked. And nutrition is not part of standard clinical care provision. It's not integrated, and the downside of nutrition not being integrated into standard care provision is obviously the impact that that has on patient outcomes. This slide is really important because I think this is the reason why many people don't make the connection between nutrition and sickle cell disease. And so when we want to look at and understand nutrition in sickle, we have to turn to the clinical features. We have to turn to the pathophysiology of sickle. And I'm going to touch on 3 key clinical features, starting with chronic hemolysis, which you will know is the rapid breakdown of red blood cells in a sickle cell patient, reduced down from 120 days to only 16 to 20 days. Some papers say 16 to 30 days. But what that means is that the patients with sickle cell end up having to live with and deal with this ongoing chronic anemia and fatigue. There's this increased red blood cell turnover, which means there's less normal red blood cells carrying less oxygen, sort of lower hemoglobin, and therefore less oxygen to perfuse the tissues and the cells and the organs that they need to help sustain, so to speak. And as a consequence of this ongoing hemolysis, we have this process of oxidative stress, which is an imbalance between the free radicals or pro-oxidants and the antioxidants, and that results in this ongoing chronic inflammation that sickle cell patients experience. The second main clinical feature, which many people know about, is the vaso-occlusion, which is the commonly called sickle cell crisis, and this is the blockage of both small and large blood vessels, resulting in the painful crisis that sickle cell patients are known for and get admitted to hospital for. And this results in ischemia, which is the interruption of or reduced blood flow, but also the interruption of blood flow in the infarctions observed. And all this, again, feeds into this chronic inflammation that is experienced in sickle cell patients. And then we've got the impaired immune function. So we know that the spleen of many sickle cell patients don't work optimally. Some of them would have had their spleens removed, splenectomies. And so they are at increased risk for infections, and infection risks also hold risks for malnutrition for sickle cell patients. So this is an important slide, and I really want you to pay attention to what I've just explained to you as a means of almost qualifying and providing you the evidence base for why nutrition in sickle cell. So what are some of the nutritional consequences linked to the pathophysiology of sickle cell? So sickle cell presents a host of complex nutritional problems and complications. And in addition to the oxidative stress I mentioned earlier, it results in the wastage of nutritional resources due to ineffective red cell production. And all of this cumulatively impacts on the growth and development of sickle cell patients. We know that sickle cell is a multi-organ, multi-system condition. So that in itself adds to the complication, certainly in terms of nutrition, and you will see later why I'm saying that. We've mentioned the inflammation, but also the overproduction of the free radicals that happens as a consequence of that oxidative process because of the chronic hemolysis that happens. But the inflammation can also be caused by iron overload for those patients of chronic blood transfusions. Infections, I mentioned, can also result in inflammation and also tissue damage as a consequence of the vaso-occlusive crisis that happens on an ongoing basis. So there's a wide-ranging clinical manifestations in sickle cell. We've mentioned the increased risk of infection, particularly streptococcal infection. Neutropenia can occur for patients who are on hydroxyurea treatment, depending on their treatment dose. There's an increased risk of malnutrition, as I've already mentioned. The chronic inflammation, patients are at risk of stroke. And again, here, these patients may need nutritional support while they're going through the active phase and the rehabilitation phase, to longer-term problems, including renal failure, liver failure requiring transplantations for some patients, cardiac failure due to cardiac iron overload, and also this increased cardiac demand that comes from the chronic hemolysis, and for some patients, chronic lung disease caused by pulmonary hypertension. So this slide just gives you some of the common nutritional problems and the recommendations on the nutrition side that can actually help to address that. I'm just going to check the time to see where we are at. So dehydration, we all know, is a problem. And I think out of all the nutrition messages, dehydration is the one that's pushed. If you talk to any sickle cell patients, they're going to tell you about, you know, we need to drink more fluid. And actually, one of the papers that I didn't mention, Mitchell 2004, a qualitative paper with caregivers, actually mentioned that the caregivers, the parents of sickle cell patients, would prefer to give their children fluid over food when they are going through crisis. So we really need to rebalance the messaging that we give, you know, around the area of nutrition in sickle cell, and not just focus on the dehydration, although we know that dehydration is a key trigger for sickle cell crisis. And then looking at impaired immune functioning and inflammation, looking at those through together, thinking about the fact that one of the clinical features is impaired immune function. And again, thinking about the diet and the oxidative stress that happens and what we can do through the diet to try and improve or reduce the effects, the negative effects of the oxidative stress. So definitely looking towards the 5-a-day messaging that you know is for every day or for all people, but certainly, you know, within a sickle cell context, looking at antioxidant rich foods, your vitamins A, vitamin C, your vitamin E, looking at foods like zinc, selenium and copper, which also have antioxidant properties, looking at vitamin D, and its role in enhancing the functioning of the immune system, and also specifically looking at omega-3s. And there's growing evidence around the use of the safe use of omega-3s as a treatment option in sickle cell disease, and so that is definitely an area that you know we could do a lot more in terms of the nutritional aspect and management of sickle cell patients. So just briefly looking at chronic anemia and fatigue, looking at the overall, the total dietary and energy intake for the patients, looking at the stress factors, you know, taking into consideration the complications that they may experience, underlying sort of medical problems they may have that can enhance that feelings of anemia and fatigue. And then constipation, you know, we hear lots of patients with constipation and as a side effect of the pain medication that they're taking. So that is something that, again, you know, usually that gets managed with what you call laxatives. But again, you know, if we look at the diet, if you look at the fiber content, if you look at the fluid, if we think about activity, you know, how we would normally manage constipation, there's lots of options and lots more that can be done instead of the first line laxative management option offered to sickle cell patients. And then in terms of the low BMI, again, just looking at the overall diet, what they're eating, how can we fortify what they're eating, you know, because the requirements are so much more than, you know, your within sickle cell patients. And so it does mean that we have to pay special attention with what they're eating, and definitely fortifying foods, definitely having the additional snacks, and maybe even going towards a little and often approach to their eating pattern. Another key thing to remember is that nutrition problems exist over the life course. And for many people, when they think about nutrition, they think about the pediatric side of things, and sometimes adolescents, they don't always go about, you know, looking at the adults and the aging population. But it's so important that when you're thinking about nutrition in sickle, that you think about the sickle cell patient across the life course. So yes, pediatrics in terms of the delayed growth and development, things like stunting, which is low height for weight for age, wasting, which is low weight for age, and then the overall disease-related malnutrition risk that they experience. On the adolescent side, we're looking at delayed puberty. We know of some patients being treated with enteral nutrition support with PEGs. You know, some of these patients can have increased infection risk because they're not compliant with their penicillin prescriptions or prophylaxis. They can have nutrient deficiencies because, again, their choices of food may be different because of the age, you know, being adolescents, etc. And again, all of these things can increase their disease-related malnutrition risk. So looking at the adults, we know that there's an increased risk of morbidity and mortality associated with sickle cell. With pregnancy, there's an increased nutrient need, you know, within pregnancy. Frailty of both the young and the old sickle cell patients, frailty of the young, you know, needing hip replacements at the age of 18 or 19, and obviously within the elderly population as well. And then gastrointestinal side effects secondary to the medication, and I've already touched on constipation. There could be nausea, there could be vomiting. So we have to really think about it in a wider context. So these next two slides is just to give you an overview of the impact of poor nutrition knowledge and awareness in sickle cell, and the following slide will be about the impact of poor nutrition service provision and some sort of provider and service user perspective. So the first one is impact of poor nutrition knowledge and awareness in sickle cell. Nutrition, as I've already mentioned, is a growing health inequality and an unmet need in sickle cell. Nutrition is underused, it's under-recognized, it's underdeveloped. There's no nutritional guidelines in sickle at the moment apart from the national nutrition standards, and there's certainly no nutritional resources available to support the management. So the impact of poor nutrition service provision, patient-provider perspectives, and this is actually comments from my research project that I thought is relevant for the presentation. So this is what people have been saying. Nutrition is fundamental. Nutrition is a massive part of my mental health. Nutrition is not part of sickle cell care. Nutrition is never mentioned. I have to do my own private research. Nutrition is overlooked. And so this slide just again reiterates and reinforces the importance of nutrition in sickle cell, and also looking at how the lack of nutrition service provision is impacting on the outcomes experienced by sickle cell patients. So if we look at the implications of neglecting nutrition, there's three key parts that I've points that I've identified. And certainly looking at compromised health, it results in compromised health. As I've just mentioned, that there is an increased risk of morbidity, mortality, and poor health outcomes associated just with the medical management of sickle cell and the medical symptoms, and resulting in the poor quality of life for sickle cell patients. There's an increased financial burden, and we see this in terms of the medical management or the medical management of sickle cell patients. And then looking at the quality of care, specifically in terms of nutrition, there is an inequality in accessing nutrition services as compared to other genetic conditions such as CF. And if there is care provision, it's not standardized across the board. And then the other part of the slide is just to highlight, draw attention to an article which I wrote titled "Nutrition in Sickle Cell, a Multifactorial Phenomenon," just highlighting again that when you're looking at nutrition in sickle, it's so much more, that you need to consider, particularly when you're looking at the nutritional assessment of sickle cell patients. So it's the nutritional considerations, which I've alluded to, the medical considerations, particularly the pain management and the effect of pain itself on sickle cell patients wanting to eat or not eat, then the psychosocial factors of dealing with this long-term condition, that, the anxiety, the depression, that can also impact on a sickle cell patient's ability to want to eat or not. And then also thinking about the wider determinants of health. So the environment that they're in, the housing that they're in, the employment that they have, the education that they have, there's so many factors that you need to consider when you're looking at a sickle cell patient, and specifically looking at assessing their nutritional requirements, in order to make tailored recommendations. So that concludes part 2, and we will now go on to part 3. And this part is linking research to clinical practice and policy change. So, as I mentioned, I'll say a little bit about my doctoral research focus, and as you would have guessed by now and by the title, that it is aimed at informing policy and practice change. But the overarching problem of my research project, my doctoral research project, is the fact that nutrition currently is not part of standard care provision, i.e. it's not integrated or embedded in the standard care provision available to sickle cell patients at the moment. So the main purpose of my research project is then to work towards supporting the inclusion and integration of nutrition into sickle cell healthcare provision. And the way that I would like to do that is, which is the outcome of my research project, is actually the co-development of a whole systems management nutrition integration framework aimed at improving patient outcomes. So the next 2 slides are just abstracts that I have submitted, that's been published, about some of the key findings of my research project. And the first one, abstract 1, looks at the influencing socio-ecological factors affecting optimum nutrition. And here I identify, which is really one of the fundamental problems in nutrition in sickle, is this lack of knowledge that I've spoken about already. And one of the quotes here in support of that finding is that all I know about, this is from a user, all I know about nutrition I've had to self-research. And then the other one I wanted to highlight with this abstract is some of the personal influencing factors that can affect the optimum nutrition needs of sickle cell patients. And I've highlighted here, and this is input from a dietitian who was part of the research project, and she's identified that depression is a big problem in some of the patients, sickle cell patients, that she sees. And so it's just pointing out that there's so many factors that we need to consider when we're looking at the nutritional needs of sickle cell patients, and certainly nutrition knowledge and the wider influencing sociological factors are things that we need to consider when we're doing that. And then abstract 2 focuses on the barriers to integrating nutrition into sickle cell healthcare provision. And here in this abstract, I identify 3 sub-themes. The first of those sub-themes is, again, the knowledge of nutrition in sickle cell being suboptimal, the fact that nutrition is overlooked, and the fact that nutrition, there's a need for nutrition management to be part of the standard management of sickle cell patients. These abstracts, I've got links in the reference list at the end of the presentation. So to summarize nutrition in sickle cell disease as part of my research project, so my mission then is increased policy and practice development to integrate nutrition into sickle cell care provision. And I've already mentioned that I'm using a whole systems management strategy to achieve that. But in addition to that, this whole systems management strategy is aimed at informing the development of future educational curricula in the area of nutrition management in sickle cell. And therefore also it will double up as a nutritional management resources that, you know, would be available to people working in the area of sickle cell disease. And my vision for my research project is simple: for all sickle cell patients to have access to nutrition service provision as part of their standard care provision. And through this, you know, increasing the awareness and implementation of the national nutrition standards, as I've mentioned earlier, page 75 to 77 of the clinical standards, and this would be to support nutrition service development and provision in this condition. So the next couple of slides are just sort of things that I'd like for you to think about that you can already start implementing in the service provision that you already provide. And particularly this first slide, acknowledging the complexity of nutrition in sickle cell, to be aware of the varied indications for nutrition in sickle that is more than just food. So some of the indications for nutrition management is infection risk, and we know that because it's increased infection risk is a key clinical feature. Malnutrition risk we've already established. Poor appetite and weight loss, because we know that pain can influence on the appetite of sickle cell patients, and there's other pro-inflammatory cytokines, interleukin-6 that can do the same thing as well. Some sickle cell patients will need oral, enteral and parenteral nutrition support, particularly those admitted to hospital. There's poor wound healing, so for those patients with leg ulcers. For stroke, particularly patients through the active phase and the rehab phase, they may have increased nutritional requirements during that phase, but even after. Patients with renal failure, patients requiring liver transplantation, patients with pulmonary hypertension, those having either needing cholecystectomies or having already had cholecystectomies. And then I've mentioned some of the gastrointestinal side effects. Constipation we mentioned already, but nausea and vomiting can be other side effects that can impact on the nutrition sort of indications in sickle cell. And then when you look at the management of sickle cell, we have to look at both the macro and the micronutrient side of things. And so in terms of the macro, we're looking at the overall energy and the stress factors. So certainly as dietitians, we would be doing that. We would be looking at the overall protein requirements, because we know, and I haven't mentioned it, but there is high protein turnover in sickle cell disease due to, you know, the increased requirements to make new red blood cells. So there's an increased protein requirement. We know about the fluid because that's the message that most people know. Fiber is something that needs to be added to the messaging as well. But in terms of the micronutrients, I've already mentioned some of these nutrients. So zinc, selenium, copper, they have antioxidant properties, vitamins A, C, and E, known antioxidants. Vitamin D enhances the immune function, and also is needed for calcium absorption. The B vitamins help with energy release in the body and uptake. Then we've got folic acid, but we know our patients are already on prophylactic folic acid. And then omega-3s, you know, that's another area that we need to think about how we can incorporate that. And I've added iron because iron does play a role, but importantly to remember that if you have a patient with iron overloading, in that case, patients are advised not to have any iron in their diet, and to reduce the intake of vitamins like vitamin C that enhances iron absorption, and to go for foods that have a lower sort of iron overall content, things like poultry, turkey, that sort of thing, and not for your meats that, you know, will have a higher heme, and that will increase the iron content of the diet. just thinking about the time, we've not got a lot left. So making every contact count, you know this, you've heard this already. So looking out for the red flags in nutrition, unintentional weight loss, prolonged poor appetite and intake, worsening and increasing complications and infections are all triggers for you to think, okay, what else do I need to do? Do they need to be referred? And then ask about nutrition every opportunity, every appointment and every annual review. Empower your patients, encourage them to know their condition, encourage them to know their nutritional triggers. What are the things that are, you know, in their diet that needs to be in their diet that's not currently in their diet? Help them to understand what their increased nutritional risks and needs are, and also help them to see the link between their health and the nutritional risks. But more importantly, empower them to ask for what they need. And this I found is a real big gap for our sickle cell patients. This slide is just to show that if you encourage your patients to speak and ask, then so much can change. So the annual Nutrition in Sickle conferences that are held in 2021 and 2022 were all inspired by sickle cell patients asking for more information about nutrition in sickle. Articles that I've written, certainly my research project has come because of my working in a sickle cell service where patients were constantly saying and asking about nutrition. So do empower your patients. And then fourthly, include nutrition in your management system. Know the nutritional implications of sickle, know the national nutrition standards and see how that can be incorporated in your management. Recognize the nutritional risks for your patients, screen them. If you can't, get the nurse to screen them or refer them on to the dietitian. Assess the nutritional risk by paying attention, check their weight loss, check their appetite, check their infection risk, etc. Refer them on to the dietitian if you've deemed from your assessment that there's increased risk or they've got more complex nutrition needs. And, you know, raise awareness of nutrition to all your colleagues, those here and obviously those not here. My call to action, the talk I'm doing today, I'm grateful for, but that's part of that. The articles I've written, the publications, the nutrition standards I've been asked to write, my doctorate, the conferences. I've also been working with the mayor of Waltham Forest to run a successful school education campaign to raise awareness of sickle cell and nutrition. So that was a really successful campaign. So there's so much that can be done. Our call to action, though, we have to think about the next steps. We need nutrition. We need a new perspective as to how we understand nutrition in sickle. Nutrition needs to be mandated as a priority, really important. We need to adopt nutrition as a management option. We need to listen to and engage our sickle cell patients, and we need to work collaboratively to influence change at policy and practice level. So from a policy and practice perspective, we need everyone. We need all the key strategic stakeholders to be involved. We need Sickle Cell Society. We need the HCCs. We need all the HCCs. We need the UK Forum, the West Midlands peer review standards. We need our third sector organisations, both health and social care. So everyone needs to work together so that we can, you know, improve our nutrition service provision for our sickle cell patients at policy and practice level. This is the last slide. So let's check the time, just bang on time. So our action: to call for nutrition to be placed on the APPG agenda. So that's the sickle cell and thalassaemia APPG. We have an obligation and responsibility to recognize and manage the nutrition needs of sickle patients. And we need to stop the effects of nutrition as an unmet need and a health inequality in sickle. And so therefore, I'd love to ask your help in this matter to actually sign a letter. I've written a letter, drafted a letter that is addressed to the Sickle Cell and Thalassaemia APPG group, requesting their commitment to placing nutrition in sickle on the agenda for open discussion. And I need your help, and I need your signatures, and I need your names to support that. So that would be my challenge to you and my request to think about that. So thank you so much, with acknowledgement to the Northwest Sickle Cell HCC for this opportunity to talk and share. And also just want to close with one of my favorite, absolute favorite quotes, and this sums up my experience with nutrition in sickle cell, this 8-year journey that that was mentioned earlier on. Do not go where the path may lead. Go instead where there is no path and leave a trail. And this is so my journey in sickle cell. And so my challenge to you is, what is the trail that you will leave in the area of nutrition in sickle cell? Thank you so much.
Thank you, Claudine. That was an excellent talk. I was going to say it's not just leave a trail for nutrition in sickle cell. It's probably leave a trail for the whole of red cells at this point, because sometimes I don't know if there's a path there. You're making the path along the way. So it's been an incredible talk and very thought-provoking. And I think there's a few. One of the things that I was thinking about, and that's been asked in the chat, I'm going to start off, and if anyone else wants to, there's a few hands raised, I'll come to you, is about leaflets. Are there any dietetic information leaflets for patients, families that can be shared? I think this is really important because, you know, if you can give a list of what they should be thinking about including in their diet, and that can be shared, you know, things like fortified cereals, increased folic acid, you know, a bit of iron. It's having that information to share, and they can then reflect on what their eating habits are like, and, you know, should they be changing. That would be a useful, simple tool to do and to start off with. I don't know if you want to come in.
Yeah, if I may. So that's precisely what I was referring to when I said about the lack of knowledge in nutrition in sickle cell. And unfortunately, at the moment, there isn't anything in existence. But through my research project, I am actually putting together, and I will have available, a nutrition in sickle cell management toolkit, which will include that information, because it's fundamental. Without that basic information, and I call it basic, without that basic information, you know, the patients are, like I've mentioned earlier, they have to self-research, they have to go onto websites that may not be evidence-based. And, you know, so that is definitely number one priority on the list. And I've already got my mouth is just gone. I already have a pro forma for that information that will probably come out in the next couple of months, if not sooner, because we have to start at that point. So very good question. And yes, it is being looked at, and that will be the fundamental starting point with moving things along for our patients.
Yeah. Absolutely fantastic. So let me see if there's anyone who wants to ask any questions, please raise your hands. I'm just going through the chat. So someone says that this is fantastic from Newcastle, saying that I'm going to make it a priority for the antenatal clinic as I deal with pregnant women. Excellent. Absolutely. There's also a question, will the Sickle Society develop any nutrition resource? Will your research help the Sickle Cell Society think about this?
That's an excellent question. The reason why I've ended off the presentation with a call for your guys to help me to send off this letter to the Sickle Cell and Thalassaemia APPG group, because I think that is the starting point of getting both the Sickle Cell Society and that statutory organization involved. I've been involved in this for 8 years. Sickle Cell Society knows what I'm doing. They know about the national nutrition standards. Nothing has changed. And hence why I'm at the point now where we have to now go straight to the sickle cell and thalassemia APPG in this way, in this public way, because until that happens, I'm going to be doing talks to a little HCC or a little, group there. And sickle cell as a whole, like you've mentioned, you know, I'm talking about a trail in nutrition, but there's a trail needed in the whole of sickle. If we want to affect change at that level, then we have to now go and focus on policy and practice level change, which is why I need your public help and your signatures to support this letter that I will send to the Sickle Cell and Thalassemia APPG via the Sickle Cell Society.
Yeah, I think it needs to come from the top, isn't it? It's just no point. It needs to come from the top. Yeah.
No point.
Absolutely. We've got two hands here. If is it Dr. Karia Swami first, and then Katie Stevenson?
Yeah, hello. So my name's Steve from a renal dietitian from King's. I was just,
Brilliant. Sorry. Yeah.
sorry, that's okay. I'm just wondering whether there's any sort of workforce planning guidance. What you're saying, it sounds like it's not quite at that level yet, but just wondering if there's any for dietitians or for any health professionals in sickle cell.
You hit the nail on the head. We're not at that point. As you've heard, we are at the point of what's the basic information available to patients. And with us being able to draft a letter to the APPG, the All-Party Parliamentary Group, and getting nutrition, for open discussion at that level, I do believe will open up the window, so to speak, for those conversations, for the workforce planning that needs to happen, and also for the evidence base to support nutrition management. So it is in the pipeline. My research project is focused around that. So hopefully that is coming, but we have this really big hurdle in front of us where nutrition in sickle isn't a thing. And through my research project, I'm calling it to become a thing. So hence why, it's an absolute priority that the APPG in sickle cell and thalassaemia places nutrition on the agenda for open discussion, so that the work that follows needs to happen. But great question, thank you. And it's good to know there's dietitians are actually excited about it as well.
Absolutely, thank you.
Yeah,
thank you.
Hey, Katie, if you want to introduce yourself and then
Yeah, hi, I'm Katie Stevenson. I'm the nurse educator for the HCC for adults. My question is that, 20 years ago, I never saw a patient with sickle cell disease who was overweight. And you've discussed the low BMIs, but we've got an increasing number of patients who are actually overweight or even obese. Teenagers with a weight of over 100 kilos. So, where does that fit in?
It fits in precisely in this conversation. Like I said, with sickle cell and nutrition, we have to take a different perspective. We have to open it up. And even though I've mentioned low BMI, you're absolutely right. Things are changing. And we have to look at malnutrition in the sense of the word, both under and over malnutrition. So in my work, that is precisely what I'm doing in terms of the research project. So the information that will be coming out, the resources that will be coming out, will definitely be looking at malnutrition in the broader sense in the sickle context, both under and over malnutrition, Katie. So you'll be encouraged.
Thank you very much. Thank you.
You're welcome. Thanks for the question.
So last final question on the chat is, Claudine, if you could say a few words about pica in sickle cell, please, by Joe Ponambalam.
Right. So yes. So that is one of the unmentioned sort of areas in sort of in the context of nutrition in sickle. One of my participants in my research project actually identified pica as a problem. So that is going to be coming through my research. The examples that was given in my research project was children chewing the collars of their school jumpers and people eating chalk, that sort of thing. It is a real thing, in sickle. And one of the papers that I can refer you to as well, it speaks about pica is the Khan et al. 2016. They actually mention pica and gives a little bit more information around that as well as being a real thing, but it's something that isn't widely known in the context of nutrition in sickle cell, but is definitely a problem that needs more attention, more questions to be asked, I would imagine, in the first instance, because like what was shared in my research project, in my focus group, this was something that they didn't know was a problem until a lot later. So I do think, depending on who you're working with, ask those questions. But a good paper to go to is Khan et al. 2016.
Okay. Well, we're going to round it off. It's almost 3 o'clock, but Claudine, it's amazing piece of work you're doing. And I think nationally, everyone appreciates all that work. As clinical teams, we are looking up for some guidance on how we can support our patient groups. So look forward to seeing that work, and thank you very much for yes, your form is there. Thank you very much for today. We'd probably circulate that signature form, Eva, probably when we send the emails. If those who would like to sign, you could sign and we can send it back to Claudine. Thanks again. Thanks everyone for joining in, and enjoy your rest of your day.